So glad to be here again talking about cleidocranial dysostosis. You guys are welcome to this session of our talk on a medical condition. And this medical condition is actually called cleidocranial dysostosis. All right. It's part of the deficiency in your bones. And today on MBBS Niger, I would like to bring you guys and quality content and educational notes on cleidocranial dysostosis. If you haven't subscribed to our channel, kindly do subscribe to our channel, like our video, comment on our video, and share our videos to your friends. Okay, so before we start, I would like to go back to the homepage. All right, so today we'll be talking about cleidocranial dysostosis. I would like to talk about the condition. Okay, I would like to talk about what causes cleidocranial dysostosis. We would like to talk about how this condition can be managed if it occurs. Okay, so moving forward, cleidocranial dysostosis is a rare genetic condition that affects your teeth, your bones, and the bones are mostly affected are bones like the skull, the face, your spine, your collarbones, and your legs. Right. So the bones in people with cleidocranial dysostosis might be formed differently or might be more fragile than normal. Okay, this is when your bones can be brittle too. Right. Your bones are brittle, they are not as strong as the normal bones. And certain bones, such as collarbones, may be affected to an extent that they will be absent. Okay, and your collarbones can even go to the extent of being absent on your body. Okay, so moving forward, the name talking about how this name was derived, and the name cleidocranial dysplasia or dysostosis. All right, it comes from cleido, which means the collarbone, right, and cranial, which means the skull. So literally it is the skull and collarbone abnormality, right, along with dental abnormalities are the main features of cleidocranial dysostosis. Okay, I think this word was mostly derived from the cleido, that's a clavicle, because when you are affected by cleidocranial dysostosis, your clavicle might even go missing, right? Your clavicle might even go missing, and trust me, I have important and brainstorming images for you guys to watch on this tutorial as we talk about cleidocranial dysostosis. Okay, so this is the first image, and you could see how this girl's face is. You could tell that her skull bones are affected. All right, you could see how the teeth is. You could tell that the teeth are affected too. All right, so you could see this second picture. All right, you could see this hollow depression on his skull. Okay, you could see that the clavicular bones are absent too. All right, this is a typical condition of cleidocranial dysostosis, of cleidocranial dysplasia. Okay, so moving forward, what are the signs? All right, what are the signs of cleidocranial dysplasia or dysostosis? Right, many different bones in the body can be affected by cleidocranial dysostosis. All right, signs and symptoms, and in mild cases this might be less obvious or hard to diagnose. All right, so this is just trying to tell you that okay, there could be mild cleidocranial dysostosis, and there could be severe cleidocranial dysostosis. Okay guys, so this is just trying to tell us that in the mild cleidocranial dysostosis, it's not easily diagnosed. Okay, you might just feel it's just a normal bone the same disorder till it gets to the critical stage. All right, so let's talk properly on trying to turn this. All right, so let's talk critically on the skull and the face, because the skull and the face are really affected by cleidocranial dysostosis. So a non-closing or delayed closure of fontanelles will learn that fontanelles are openings on the skull, okay, where the sagittal suture meets the coronal suture. You have the anterior fontanelle there, where the sagittal suture meets the lambdoid suture. You have the posterior fontanelle. And in adults, we learned that these fontanelles actually fuse, okay, where you have the anterior fontanelle becoming the bregma, and you have the posterior fontanelle becoming the lambda. All right, so non-closing or delayed closure of the fontanelles, the soft spot between the skull plates in the infant, and normally the skull plates knit together as the baby matures in childhood. All right, a wide and flat or protruding forehead, sometimes with a vertical groove down the center. That's why I told you about and that depression on that man's skull. Okay, a low or wide and nasal ridge, okay, wide set eyes, okay, and a small mid face and lower jaw, okay, high arched hard plate or cleft palate. You might even develop a cleft palate due to this. All right, so how does the cleidocranial dysostosis affect your teeth? Okay, baby teeth that do not come out on their own, okay, impacted adult teeth that may be encased in bone and cannot grow on their own. Okay, so you have a supernumerary teeth, that's the extra teeth. You have crowded teeth, that's same thing as supernumerary teeth. Okay, malocclusion. Okay, you find out that your teeth do not meet properly when biting. Okay, even when you close your mouth, you find that your teeth are not meeting up properly. All right, so this is a typical cleidocranial case where the clavicular bone is missing totally from the chest region. Okay, and actually they could stand normal, but you could see how they could twist themselves, and they are so flexible because there's the absence of the clavicular bone, which separates the upper limb from the thorax. Okay, you could see it's another gymnastics happening here. Cleidocranial dysostosis. So how does the cleidocranial dysostosis affect other areas of the body? You could see that individuals that come up with cleidocranial dysostosis have short stature, and they incompletely form or missing clavicles, like I told you, and short fingers, narrow chest, extra or missing ribs, all right, and deformities in the pelvic bones, which can complicate childbirth. Then they have scoliosis, that's curvature of the spine. The spine is curved. All right, so this cleidocranial dysostosis, I know you have seen the images I've put out, and you could get to know that, you could get to confess that this condition is actually not a friendly one. Okay, so we want to actually know what causes the cleidocranial dysostosis, what causes the cleidocranial dysplasia. So cleidocranial dysplasia develops when there is a problem with the RUNX2 gene, which plays a role in the formation of osteoblasts, the cells that create bones in the developing body, in the maturation of chondrocyte, and the cells that produce cartilage. Okay, so if you know that, you could get to infer this when we're talking about cleidocranial dysplasia. From the overview, we got to see that, okay, cleidocranial dysplasia is actually a malformation in bones. Mainly you can see bones of the chest, bones of the skull, and so on and so forth. Okay, so this could get you to relate that, okay, and this problem was actually brought up by the primitive cells that make up bone. Okay, so you could see it there. Okay, and so cleidocranial dysplasia treatment, all right, if we have learned about the cause, okay, we got to know that it was a RUNX2 genes, okay, and how can we manage this situation when it comes up. And treatment depends on how the syndrome affects the patient. That's the severity, okay. And people with cleidocranial dysplasia may undergo multiple and orthopedic, facial reconstruction, and dermal procedures to improve their comfort and function and well-being, okay. You could see that definitely an individual who is down with this situation won't really have that self-confidence. He will always feel he's not looking nice. So these bones could actually be reconstructed, okay, so that this could actually be managed. Okay, you could see this picture, and then this picture is focused on the teeth. Okay, you could see how these teeth are not really lapping even when this guy close, and you could see missing teeth. Okay, all right, you could see missing teeth. All right, and you could see the decay of the teeth. All right, you could see this picture too. You could see that the guy's collarbones are missing. All right, you could see that his neck is not really in proportion to his body. So for children, facial reconstructive surgery on the bones of the face to reshape the forehead and the cheekbones can be done, okay. And spinal fusion procedure to support the spinal column, and lower leg surgery to correct knocked knees that prevent inward toward the center of the body, and surgical repair of fractures due to fragile bones, okay. All right, so surgically your bones can actually be reconstructed, right? Your bones can actually be reconstructed by surgical method, various surgical methods, okay. So a removal of small collarbone pieces, all right, that's when your collarbone develops but does not develop properly. So removal of the small collarbone pieces can affect the brachial plexus and cause arm pain or nerve problems, okay. And ear tubes to treat ear infections, right? A protective helmet might while playing sports, okay, because you know that the bones of your skull are not properly developed. So if you are down with cleidocranial diastosis and you must engage in sports, okay, of course you need sports, okay, to exercise your bones. You must wear a helmet so that you don't have this direct contact with your skull. Okay, so and treatment of dental problems caused by cleidocranial dysplasia. Of course, you could see that there could be a case where your teeth are crowded, as a supernumerary teeth, and there could be cases where your teeth are actually scanty. Okay, so how can this be treated in particular? The orthodontics and the oral surgery can address extra or impacted teeth. And the first step is a careful assessment of each tooth, followed by extraction of any extra tooth. And to maintain viable teeth, practitioners might remove gum tissue and guide growth of these tooth into the mouth with braces, okay. You could see all those braces that the dentists use to guide the growth of teeth and so on and so forth. For a faster result, some patients prefer implants, bridges, or dentures. Sometimes jaw hinge surgery is necessary to correct the bite. Okay guys, with this I would like to call it a done from the cleidocranial dysostosis or cleidocranial dysplasia. All right, we are done with the tutorials on this medical condition. Okay, and with this I would like to tell you that bye for now from MBBS Niger. If you haven't subscribed, do subscribe, like our video, comment on our video, and the next tutorial will have so much in stock for you. All right, so stick to our channel as we bring you more and more content. So guys, bye for now.